We're ready next.
Next, Mr. Chairman, Pat Sweeney from the Mahoning County Board of Health asked to speak before the Board of Trustees in the community of Poland.
Thank you very much. I'm not sure where to stand, so the
right there.
Oh, really? I don't have my back to the residents though either. So, okay. Well, thank you very much. I appreciate the opportunity to be here. I'm making 3 stops tonight: Poland Township, Lowellville Township, and Springfield Township. So, we have been making an effort to be certain that we get to all of the townships and villages and cities in the county, because we have been presented with an opportunity for the first time in the history of something being done that is offered by the Federal Department of Health and Human Services and the Centers for Disease Control and Prevention. And that is something called the National Health and Nutrition Examination Survey. It's NHANES is how it's referred to. For 55 years, the Centers for Disease Control and Prevention have been conducting this study annually across the nation. Every year they pick 15 to 17 different counties that are representative based on the census. They select counties that represent the entire population of the United States. And they select neighborhoods within those communities, and that's why I'm here specifically to talk to safety forces, is to let you know that Mahoning County has been selected as one of the counties, one of the 15 counties that they're going to be visiting this summer. For a public health person, this is tremendously important, because from the National Health and Nutrition Examination Survey, the data that they collect, we have been able to figure out normal growth charts. When you take your kids to the pediatrician's office and you see those growth charts, that is a direct result of the National Health and Nutrition Examination Survey that's been taking place for 60 years. They have been able to figure out what exactly we need in labeling on food products for people to better understand. They have figured out our trends in our diabetes rates, trends in body fat percentages, trends in physical activity. All of this data comes together from the nation, and it serves as the basis for public health policy nationally. So they have identified, the Centers for Disease Control and Prevention have identified different neighborhoods within the county where they are going to actually send letters, this is all on the phone, send letters to residents and let them know that they're going to be coming with CDC badge, photo ID, saying who they are, coming into the neighborhoods, knocking on doors and asking questions. They're going to be asking survey questions. How many people live in your household? What are their ages? What education level, income level, race, ethnicity? And from those questions, they come back with that information, and a computer generates up to 300 individuals that they're going to ask to participate in an actual physical examination. And I really don't like having my back to you, because this really involves all of you. I am coming to talk to the township representatives and elected officials so that they know what's coming into their township. But it's all of us that will be invited to participate, either in the survey, and if in the survey, then also potentially to be participant in the examination. They bring in 5 medical grade, hospital grade trailers, and they selected the site at the Southern Park Mall at the corner of California Avenue and 224. And they bring these trailers in, and that's where the physical examinations are conducted. And the physical exams could be anything from a bone density scan, height, weight, body composition, to dental exam, to blood work, to urinalysis. It just depends. One of the things that they have figured out through the NHANES historically, when I went through nursing school and I graduated in 1979, and I hate to say that out loud, but it was 1979, a blood lead level of 50 was considered childhood lead poisoning. That was a lead poisoning level. When they did the NHANES studies over the years, around the 70s, they learned that 98% of the population that they tested had lead in their blood. So they recognized that exposure was rampant in the country. So that is when legislation was passed and public health policy changed, where they removed lead from paint and lead from gasoline. And over the years, they have now seen this drop down to less than 2% of the population that has lead in their blood now because of this exposure. So it's that kind of policy, and the childhood lead poisoning level has dropped from 50 down to 5. So that is now considered childhood lead poisoning. So these tests that they're going to be doing now, they test for things like arsenic and things that don't happen in your general physician's office. The other thing that happens when someone does the survey and they are invited to participate as an examinee to be examined at the Southern Park Mall in one of the medical trailers, it's voluntary. It is totally voluntary from the moment they knock on your door to if they invite you to participate to have an exam. And it is completely completely private. No information is shared with anyone but the Centers for Disease Control, and it is not reported back to the county, so it's not as if, here's the health status of Mahoning County, and aren't we in bad shape? It serves as the foundation for health policy so that they know we get a chance to say, this is the status of health here in this county. This is what we look like. These are our health issues. These are our concerns. This is what we think about health. And that serves to go back into the whole country and to drive health policy. So it's a really wonderful opportunity if you are asked to participate. Also, if you choose to participate, there is a stipend that the CDC does pay for people who go through the examination process, and there's transportation provided if that would be a hardship. So they make it as easy as they can for individuals to participate if they choose to do so. It is something that is sanctioned or supported by the local health department because of the science that this has generated over the years. This is good science, this is good efforts, this is something that is paid for entirely by the federal government. There's no money coming out of this county for any of this work, but it gives us an opportunity to have a say and have our stake in what public health policy looks like. Each person that goes through an exam represents 65,000 people in the country. So your health status represents 65,000 other people in the country just like you. So, any questions, I'd be happy to answer. As I said, I want to come to all of the county townships and villages to let you know that this is coming. They have selected neighborhoods. There's one in Canfield and Salem, that area that's in Mahoning County that kind of borders both. 2 segments in Canfield. There is a segment in Poland. So there are households that have been identified already that they will be sending letters to and knocking on doors. Struthers, there are 2 segments. Lowellville has one, Campbell has one. Youngstown, Lowellville, New Middletown, Poland, that whole corridor has another segment. And then there are 15 segments within the city of Youngstown that have been selected. So we know that they will be knocking on doors, they will be coming to the community. We do support it. We are going to have information up on the website about it. They have provided us a video that can play over and over again. People can call and ask any kind of questions they would have. We are more than happy to answer. Do you have questions about it at this point?
Do you have any idea of which neighborhoods or?
We don't have any idea which neighborhoods. And
you
what they forgot to tell you
as
is,
it gets closer, would you?
no, they will not tell us. It is entirely private, so that I don't know, I don't even know if there's another county in the state that's been identified. I asked that question and they just keep it entirely private. The other thing is that an individual that does actually go through the testing receives the results. So the individual benefits from this examination. So they get their own results, but no one else does. They can take it to their physician. All the other data just is collaborated or aggregated into the national data. And this starts May 22nd, and it goes through mid-August. And there will be a press day and a day open for the public. They're going to make quite a bit of press available and have, I believe it's June 12th, that the elected officials and the public will be able to come in, take a look at the medical trailers and see what that's all about, and get a better sense of what they're going to be doing here in the county.
I'd just like to say whatever we can do to make it a success, let us know,
I think this is it. I mean, just giving you the opportunity to come in and talk to the community, talk to the leaders of the community. You will probably receive questions about why is somebody coming from the CDC and the community. You're the first people they go to. Just so that you're aware that it is happening, that it is something that we support wholeheartedly because of the science that comes from it. It's nothing there's no for-profit anything that comes out of this. It is just aggregated data so that they can track and understand the health trends, the health status of our nation, and adjust policy to adapt to and to address the health needs of the country. And for the first time in this whole study ever being done, it is being done here. And that's pretty exciting for them.
So, Mr. Furrier, thank you for those lead numbers coming down.
Yeah. He's doing his part.
Nice job.
Yeah.
Well, in addition to that, I saw a news report where Northeast Ohio's got the longest living residents in Ohio, so give you credit there too.
You know that?
Oh yeah, absolutely.
I'd like to see that one.
Yeah, news just came out yesterday or today. Yeah, in the state of Ohio, Northeast Ohio has the longest living residents due to a lot of the health things that are going on with respect to hospitals and other activities that are taking place.
So acute care, we do have
Nice job.
good health care. Yeah, I wish I could claim it, I can't.
Come on, I'm trying to help you.
Thank you. Any questions from any individuals? Well, thank you for the opportunity to talk with you. Thank you. And with that, I am going to excuse myself and make my way to Louisville.